I was fascinated with the field of electrophysiology from the beginning of medical school. Right before I started medical school, my dad survived cardiac arrest, and that always kept me interested in the field to figure out more about it and how can I help other people survive cardiac arrest. And that's probably what initially made me interested in the field. Electrophysiology at Spectrum is pretty special. We have a large team of specialists who trained all over the country, and our diversity in training allows us to handle and tackle all sorts of arrhythmias, from the simple to the complex. Atrial fibrillation is a very common arrhythmia, the most common arrhythmia in the world, and it can give patients an array of symptoms, and some patients can struggle for years with palpitations and fatigues that they cannot pinpoint to the arrhythmia itself. And in electrophysiology, we deal with this array of arrhythmias and try to fix it, sometimes with medications, sometimes with pacemakers and defibrillators, and oftentimes with a procedure called an ablation. An ablation is when we put catheters in the heart and find the focus of the arrhythmia. We try to modify the heart's electrical system by burning some abnormal spots and try to modify the way the electricity runs through the heart to eliminate the symptoms of these arrhythmias. They can be curative often, sometimes they're not, but they make people feel a lot better. The benefit of coming to a place like Spectrum is that we have a collaborative team of surgeons and cardiologists that can come up with a complex plan to take care of the patient entirely. We can offer anything from a heart transplant to a mechanical support to valve replacements to complex ablation procedures from an electrophysiology standpoint. It's always good to be at a place where the doctors think as a team and figure out the best treatment plan for an individual patient. Coming to work is easy when you see the satisfactions on patients' faces in the morning. Usually we round on the people we helped the day before, and the instantaneous relief they get from our procedures is what keeps a smile on my face and keeps us motivated to keep going with our days. It's easy to do my job with that type of positive feedback. Patients in West Michigan tend to be very appreciative of the help we can offer them, and it's quite a rewarding experience.